Yes, good morning, wonderful people. How una dey? Once again, we dey greet una simply because we talk a few minutes ago say we go to kaya enter the health segment where Dr. Bati go dey enlighten us. He go dey sensitize us. You sef, you go feel free to ask any question pertaining to your health. My name is never change. Na still Chief Olododo, and our doctor a day yes, leave me a car once
Chief,
again.
good morning. Doctor, good morning.
Yeah, thank you. Let me break the protocol for once. Starting with the female, as I should always do.
As
Good
always,
morning.
good morning,
Yeah,
doctor.
Tifo.
Good morning, sir.
Sorry, I have to greet you second.
Ladies
Is that now
first.
that you understand? Good morning, guys.
How are
Thank
your
you for joining
patients?
us.
Yeah, we are doing good. Yeah, good morning, viewers at home and around the world. Today we'll be looking at the topic we started some 2 weeks ago. But before I go ahead with the topic, I want to extend my special thanks and appreciation to the doctor that was with us last week, talking about the consultant urologist who was here to kill the topic. Dr.
Talabi?
No, Dr. Okpeyemi Alabi. He is a consultant urologist, works with Federal Medical Center here in Ebute Metta, Lagos.
Okay.
Okay, so this morning we'll be going back to the topic we started 2 weeks ago.
2 weeks ago, okay. So, of course, now remember I said we've been start off with something just like waiting doctor been talked 2 weeks ago, but then we've been get a special guest. We've been talked so much on that. And doctor is here to continue.
Yeah, thank you very much. So this morning we'll do a recap. We'll give an overview of all that we have said. Okay, so we'll try as much as possible so that we'll be able to take a lot of questions and then go as far as treatment of those conditions that we have spoken about. But as a word of introduction, we'll talk briefly about the anatomy of erect penis. Okay. We'll give a definition, as we always do. We'll give the signs and symptoms. We'll talk about the causes. We'll talk about diagnosis. We'll talk about prevention, risk factors, as well as treatment. And then and we conclude, hopefully, by the end of today. So, erectile dysfunction. Let's start by saying that erectile dysfunction is a problem that has global affectation. In the US, it said that it affects about 30 million American men. Okay? Some studies said that 3 in every 10 men that are within their adult age group will actually have challenges with erectile dysfunction. Some other studies put it at 1 in every 10 men. So it's a problem that is common, it's a problem that is global, it's a problem that we encounter in all parts of the world. Okay? Now, let's talk about the anatomy of erect penis. Now, every man ideally should have a penis, okay, except in situations where you have abnormal congenital malformation that can occur in the womb, or some people can be born with some form of congenital malformation. But in an ideal situation, a man should have a penis, a penile shaft, as well as 2 scrotal sacs or scrotum. Now, but when you talk about the anatomy of erect penis, we are narrowing down to 3 main structures. Number 1 is the fact that we have the corpora cavernosa, which is an erectile tissue that surrounds a middle intervening tissue that is called corpus spongiosum. Now, the 2 of these structures are covered in a thin sheet, fibrous sheet, that is referred to as tunica albuginea. All of these play a role when it comes to erection. Now, what happens is that the 2 corpora cavernosa on either side are spongy-like tissue that can be filled with blood. And when it is filled with blood, it usually expands and becomes stiff. Okay? Now, in between the 2, you have the middle structure that is called corpus spongiosum. This corpus spongiosum also transmits the tube or pipe that conducts urine from the bladders to the exterior, as well as semen in situations of sexual intercourse, otherwise known as urethra. Okay, we have a picture on our screen so that to enable us to understand what we are talking about. Now, all of these 3 structures are covered together by a fibrous thin sheet called tunica albuginea. What happens is that when the man gets some sensations that will bring about erection, what happens is that there's a complex interplay between the psychological components, the neural, the vascular, as well as the endocrine complexes. Okay. Now, this process will bring about an inflow of blood. Usually, the stimulation will start by when a man is touched sexually, or when a man entertains some erotic thoughts that will bring about stimulation and excitement in the brain. Okay, so what happens is that this complex mechanism or process will bring about a release of nitric oxide, which is a form of vasodilator that brings about increased inflow of blood to the penile shaft.
It makes it erect.
Yes. Now, when this blood is coming in with full force, this usually happens within minutes. Okay? The tunica albuginea kind of serves as a compartment that locks and blocks everything. So you have blood coming in, but there's no venous return. The blood is not going back. So this happens simultaneously. And as this is happening, the penis is becoming engorged with blood and is becoming enlarged at the same time.
That's for a normal walking penny.
Walking penis. So that's what we have when you have an erection. But erectile dysfunction has to do with, yes, when we have challenges with any of these components that we mentioned, when we have challenges with the neural component, the psychological component, the vascular component, as well as the endocrine component, you have any form of challenges with this, it will bring about decreased blood supply, limitation of blood to the organ. Okay, and oftentimes we also have, when we talk about the neurogenic component or the neural component, we talk about the nerves. Okay, so anything too that can damage the nerves can bring about erectile dysfunction. So what then is the definition of erectile dysfunction? Erectile dysfunction can be defined as the consistent and recurrent inability for an adult male to achieve satisfactory penile erection, leading to satisfactory sexual intercourse. Okay, so in other words, it has to do with a persistent and recurrent inability for a man to achieve satisfactory erection that will bring about satisfactory sexual intercourse. Okay, now there are two key words there. Number one, it has to be recurrent, it has to be persistent, and it has to be consistent. Okay, because oftentimes as men, we may encounter challenges with erectile dysfunction in our lives. Occasionally, you discover that a man that you're not at your best. Okay, that happens to us from time to time. But when it becomes persistent over a period of time, there is a problem.
It gradually turns into a vegetable.
That's a problem. Okay, so that's what erectile dysfunction is all about. Now, talking about the causes of erectile dysfunction, there are a number of causes of erectile dysfunction, and we have spoken about quite a number of them in the course of this presentation. Number one is that there are organic causes. Okay. Let's start by saying that majorly there are physical causes and there are psychological causes. Okay, under the physical causes, you have the organic causes. Now, under the organic causes, you have cardiovascular problems. Okay, under the cardiovascular problems, you have problems like hypertension, problems like high cholesterol, problems like
diabetes.
No, diabetes is another another subtopic. Really? Okay, so these are some of the things that you can have under cardiovascular. Now, under the second one should be, I've talked about the cardiovascular component.
We have neurological too.
Yes, no. Under the neurogenic. We are talking about nerves. We are talking about nerves, majorly problems that affect the nerves. Okay, diabetes can affect the nerves. Multiple myeloma can affect the nerves. Parkinson's diseases can affect the nerves. Sometimes too, some form of trauma to the spinal cord. Okay, oftentimes too, some surgical procedures that involves the spinal cord too can actually lead to such problems. Oftentimes too, some form of exercise like cycling, riding a bicycle for a prolonged period of time can bring about pressure symptoms that can affect the perineum as well as and eventually end up compressing some of the nerves. But in this situation, this type of erectile dysfunction can sometimes be reversible if the underlying cause is taken out. Okay. Now, we've talked about the cardiovascular components. We've talked about the neurological components. Now, the next one to talk about is the endocrine component. Okay. So, under this endocrine component, we are talking about things that affect the hormones. The male sex hormone that is majorly responsible for erection in man is called testosterone. Oftentimes, if you have it in reduced form, as a result of any maybe hormonal imbalance, that can also affect erection. Okay, now the next one we want to talk about is the psychogenic or the psychological component. You agree with me that anybody who has challenges with depression or anybody that is stressed in any way, sometimes we come across life stressors. It comes in a number of ways. It could come in form of financial stress. It could come in form of marital stress.
Say person wey receive sack letter from work now.
Yes.
Say
now, what will be uppermost? Yes. What will be uppermost in such a person's mind will not be sexual stimulation or intercourse. So sometimes in life we come across challenges that can actually affect our sex life. Okay. So we usually refer to them as psychiatric conditions. Okay. Depression can cause that. Anxiety can also cause that. Sometimes you have performance anxiety. In some people, it can also bring about erectile dysfunction. Now, one of the things that we have not been able to talk about is what we refer to as Peyronie's disease. Peyronie's disease. I would like to talk about it because I know a number of individuals may have these challenges or may have some of these problems. Now, Peyronie's disease is a condition that is brought about by the deposition of some hardened plaques along the penile shaft. Oftentimes, it could be above the penis. Now, if that happens, if the deposition takes place above the penis, during erection, the penile shaft will be curved upwards. And of course, it comes with pains as well as distortion. Okay, so such an individual will experience curvature of the penis and undue curvature of the penis upwards that could come with pains. Okay, now sometimes too, the deposition of the hard plaque, fibrous plaque, could be below. Don't forget, at the beginning when we're talking about the anatomy of the erect penis, we said that the two components are usually covered by the tunica albuginea. Now, this tunica albuginea is a fibrous sheet. It's somehow unyielding. Okay, so when you have the plaque attached to the lower border of the penis, that can bring about curvature towards the ventral surface. Okay, in an erect penis, that will come with pains as well. So people who have these challenges, okay, will also have erectile dysfunction. Okay, but when we talk about the treatment, we'll talk about the treatment of all of them generally. Okay, other things that could cause erectile dysfunction are drugs. Some of the drugs that we take, for example, the drugs that we take to correct, thank you very much. The drugs that we take to treat anxiety disorders, okay, like antidepressants, some of them can actually cause erectile dysfunction. Some hypertension drugs too can cause erectile dysfunction, okay. Some of the painkillers that we take on regular basis, non-steroidal anti-inflammatory drugs, okay, otherwise known as NSAIDs, NSAIDs, can equally cause erectile dysfunction. So we need to be careful on the drugs that we are taking. So sometimes you may be looking beyond what may be causing your problem, and unknown to you, it could be just another bystander somewhere that may be responding. It may have to do with the drugs you're taking. Apart from these drugs, some of the drugs too that are used in the treatment of PPH, BPH, benign prostatic hyperplasia, like finasteride, okay, can equally cause erectile dysfunction. The same drug can also be used in the treatment of bad health for people who have this condition. So we need to know that some of the medications that we're taking can equally lead to erectile dysfunction. Apart from drugs, unhealthy lifestyle practices too.
Before we go to
Smoking,
the unhealthy
drinking.
lifestyle practices, Dr. Sharply, make we open our phone lines, and as we dey open the phone lines, people go feel free, call in, ask any question from Doki. On top any of these things where they do your mind the yaga yaga.
Yeah, yes, Chief. Okay, so the numbers are on screen, 081. I think we need to go for the break. Should I call it or come back?
Are we going on a break? Okay, call it. then
Okay.
we'll go on the break.
All right, so 08105434981. Of course, 08173147589.
Okay.
We'll be right back.
I've been saying it since. I want to be an actress, but all of you keep making me write Wayeki.
Scott! We're not going to be picking you this time.
I used to act film, and I just came to Lagos.
Just stick with me.
Say,
Scott!
I don't know whether I'm friend.
In a what time Neku? God, you.
We have a whole night.
We do. I can't wait to slay the red carpet, you know.
Let's go in and talk about this.
But she is my star actress, and she stays.
Babe.
It's not right. You know, Chris! You people should pack out this rubbish equipment.
I am having a meeting with this man here.
What? Don't try fool with me, let me tell you. Is it who you are talking to? Are you mad?
Erectile dysfunction or impotence is a condition wherein a man experiences inability to achieve and maintain an erection for a satisfying sexual experience. Erectile dysfunction commonly occurs in elderly people because the erectile capacity decreases with age. Erectile dysfunction may occur when the blood vessels going to the penis become blocked or narrowed. There is an interference with the nervous system that triggers erection, or when there is a reduced libido. Certain diseases may cause blockage or narrowing of the blood vessels, such as diabetes, hypertension, multiple sclerosis, nerve damage, hormonal imbalances, atherosclerosis, and heart diseases. Unhealthy lifestyle choices also predispose an individual to have erectile dysfunction. A person is more likely to develop erectile dysfunction if he is obese, alcoholic, smoking, or abusing drugs. Medications may also cause erectile dysfunction as its side effects, like with antihypertensives, antipsychotics, antidepressants, and tranquilizers. Psychological causes can play a part in the occurrence of erectile dysfunction. People suffering from stress, fear, gloom, uncertainties, sadness, or problems in the relationship can suffer from erectile dysfunction. Often, erectile dysfunction is caused by a combination of physical and psychological causes. A person who suffers from erectile dysfunction may experience symptoms that include difficulty getting an erection, inability to maintain an erection, and decreased libido or sexual desire. Lifestyle modification is the least invasive type of treatment for erectile dysfunction. Healthy lifestyle choices that can help relieve erectile dysfunction are to stop smoking, drink alcohol moderately, lose weight when you're overweight, stay away from substance abuse, and to be physically active. Erectile dysfunction caused by medication can be treated by replacing or cutting back the medication under guidance of a physician. Psychotherapy is used to treat erectile dysfunction caused by stress and anxiety. It is also important to talk with your partner about your complaints. Medications like phosphodiesterase inhibitors and testosterone can also be utilised. These medications can only be taken orally, injected directly to the penis, or inserted into the tip of the penis. Your general practitioner can give you more information about the disorder and its possible treatments.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top with health matter. You fit also advertise your product and services on top with show where dey help people. Terms and conditions apply sha o.
For advert placement and sponsorship, make una call Stella Maris on top 070 3914 5229. Rebecca 070 6969 1950.
Yes, you're welcome back to the show, and doctors today do justice to the topic we will get for hand will be ED, erectile dysfunction. On top of erectile dysfunction, you don't talk about a whole lot of things as blood vessels, as blood they enter the penis where they make and rise. Tabi if shortage of blood they happen, we can cause the ED itself. But it never finish. Yes. Instead the tissues they go. Doki?
Yeah, thank you very much.
Oh, yeah,
welcome back once again. So we talked about unhealthy lifestyle practices, and then we'll saw plenty of that being explained to us on the short video clip that we watched a while ago. Okay, so it's a well-known fact that obesity is a risk factor, not just for erectile dysfunction, but for a number of other disease conditions, other medical conditions. So if you're obese and you're having this challenge, now you know what to do. You need to start making efforts, okay, to shed some weight and stay active, okay? Sedentary lifestyle too could play a role, okay? If you are an alcoholic, you need to limit or avoid alcohol as much as possible. Have Wale from Lagos. Wale, good morning, sir.
Good morning, Wale.
Morning, sir.
How you doing?
Thank you very much.
I'm okay, I'm good.
All right, please, you get question or contributions to make?
Question was,
I'll go on now.
You know, my friend, anytime he's sleeping, there is no way.
You have to take that again.
One of my friends, anytime he's sleeping, he's always snoring.
Okay, your friend is snore where? Well,
if he sleep, so what can we do? We help perhaps.
Okay,
thank you.
Okay, so you're asking for the treatment.
Yeah.
Okay, thank you very much, Wale. Snoring can have something to do with posture. Sometimes the way we tilt our head while when we are sleeping can actually bring about snoring. Okay, one of the things too that can cause snoring is obesity. We've just spoken about it a while ago. Some people have webbed neck or short neck when they're fat. That can equally contribute. Beyond all that, anything that can bring about obstruction in the airway passage, okay, can actually bring or cause snoring. Okay, so but my advice would be to that your friend that you talked about, please beg him to go and see his doctor so that he can be properly evaluated and then treated accordingly.
I remember saying that something we don't treat here before.
Yes,
and it gets solution.
Earlier in the year.
Brought,
yes, we talked about a number of things that when we brought our ENT surgeon in the house.
Yeah.
Nose and throat. Yes, thank you very much for that question. But today we are dealing with erectile dysfunction. Okay, so we were talking about unhealthy life practices that we need to stop to actually bring about an improvement in our sex life, and we mentioned some of them. Smoking, we've talked about that. Limiting your alcohol intake or abstaining will do you a world of good. Okay, staying active, learning to imbibe exercise at least 20 to 25 minutes 5 times a week will be an ideal way to start up.
We have Sepo
from Rivers.
Sepo from River. Good morning, sir.
Good morning, sir.
How are you there, sir?
I'm fine, sir.
Okay, go ahead with your question or contributions, please.
Okay. I saw your...
Can you speak up and turn down your
Good morning.
Yeah, we can hear you. Go ahead, sir.
Yes. I saw your topic on discussion this morning, erectile dysfunction.
Yes, thank you very much.
I don't know what is the cause and how come? Can you hear me?
Yes, we can hear you loud and clear.
Okay. Okay. Yeah. I saw your topic this morning.
Your volume is loud. Turn it down.
The causes and cure, if we actually get to example.
Yes, we'll go the causes. Okay, so we'll go over the causes again once more, okay, briefly. Okay, we said at the beginning that the causes could either be psychological or physical. You have physical causes, you have psychological causes. And under the physical causes, you have some other, under the physical causes, you have a number of subtopics. Yeah. Number one is cardiovascular problems, in which case you could have hypertension. You could have problem with cholesterol. If you have problems with clogged arteries that supply blood to the heart, otherwise known as atherosclerosis, okay? These are under cardiovascular. Also, you have some neurogenic factors that affect the nerves.
I think he's calling the Daniel.
Lagos.
Hello, good morning.
Yeah,
good morning, Daniel.
Yeah, I just everyone in the studio.
You need to speak a bit louder.
Okay. I just want to ask if masturbation can cause erectile dysfunction.
If hypertension.
If hypertension is
it causes erectile dysfunction.
Thank you very much. Yes, Daniel, we just said that a while ago. Yes, hypertension can be a cause of erectile dysfunction, as well as the treatment of this condition as well. Okay, so some drugs that are used in the treatment of hypertension have also been implicated as some of the causes of erectile dysfunction. Okay, so that takes us back to the question we were dealing with before your question came in. So neurogenic factors, okay, under this we have diabetes. Diabetes can cause erectile dysfunction in two ways. Number one, it can cause damage to the important nerves that subserve this function. Number two, it can bring about the reduction of blood flow to the penis, impeding blood flow to the penis. So anything that can actually affect the innervation as well as the blood supply to the penis can actually cause erectile dysfunction. Okay, among the neurogenic diseases that can cause erectile dysfunction, we mentioned at the beginning, we talked about multiple myeloma, we talked about Parkinson's disease, we talked about also, I want to quickly chip in that epilepsy can equally come in this class. Epilepsy can also be a cause of erectile dysfunction, okay? And polio too can often and equally cause erectile dysfunction. Okay, so under endocrine factors, you have things like hormonal imbalance, okay? If any condition that brings about reduction in testosterone, which is the male sex hormone, we also cause erectile dysfunction. Apart from the physical causes that we have mentioned, there are also psychogenic or psychological causes. Psychological causes will include things like stress and depression. We usually refer to them as psychiatric medical conditions. Stress,
state of mind generally.
Yes. Okay, can actually bring about erectile dysfunction. Permit me to also give a link still on the psychological causes now. Now, oftentimes, erectile dysfunction on its own can actually bring about depression and anxiety.
Obviously, yeah.
Okay, so it could be a bidirectional arrangement in the sense that erectile dysfunction can bring about depression, can bring about low self-esteem, can bring about anxiety, okay? And the reverse can equally be the case, and vice versa, okay? So sometimes erectile dysfunction that are arising as a result of, or that arose as a result of medical conditions like hypertension, when a man cannot be the man of the house anymore, oftentimes we find it difficult to share our sexual habits, not just with our partners, even with our doctors. Okay, so that's why this program is important.
Because some people, they think say the thing no get cure.
Yes, so that's why this program is important, so that you and I can learn a thing or two. Okay, that yes, these are challenges that other people are going through, and doctor is saying that there are solutions in sight. Okay, but you need to open up. You need to share your problem with your doctor, because a problem shared, they said, is a problem solved. Okay,
Doctor, sorry, before you move on, sir, sorry to cut you, sir.
Yeah.
Our own general belief that what we believe, we say those two eggs, we they call them. Those two eggs, where mind they carry. Say if something happen, maybe perfection accident. Say if the egg break, say person no go fit to ejaculate, tabi to produce pikin again. Have you, in your years of service as a doctor, have you come across a scenario or a situation, or be it in medical school, where that egg, permit me to use the word egg, I know you know what I'm talking about, where that egg breaks, and when it happens, what is the next way forward?
Thank you very much. That question, I must comment. That question is a medical one. It's truly medical. Okay, so he's talking about testicles. Okay, oftentimes in life we see conditions that can actually bring about. First, I want to say that some people, we've seen situations where people are born with just one testis. That can happen. In some situations, we have Prince from Rivers. We'll come back to your question, okay, sir.
Good morning, Prince.
Good morning.
How you doing?
I'm fine.
Dr. Bazi, there, go on with your question.
Okay. I want to ask. Hello?
Hey, we can hear you.
Okay. I want to ask, what causes hormonal imbalance?
What causes hormonal imbalance? The voice was Prince, but
I think yours maybe just one call.
Yeah, okay, the name was Prince, but the voice was a female. We are hearing from a princess.
We are hearing from a princess. So.
Okay, thank you very much. Let me point out at this forum that hormonal imbalance can happen in both males and females. Okay, now, oftentimes, it could be as a result of, number one, some of the causes may not be known to medicine. So sometimes the cause may be unknown, okay? But oftentimes it may have to do with the person's genetic makeup, okay? For instance, there's a problem that affects the males only now that is called Klinefelter Syndrome, okay? Now, what happens is that the males, in such situation, males are born with extra copy of chromosome. So instead of having the normal 46 chromosome that a man should have, normal 46 chromosome X and Y, the person will have an extra copy of X. You have that condition in Klinefelter syndrome. And this Klinefelter syndrome too has been implicated as a cause of erectile dysfunction. And it is brought about because people who have this condition will have low testosterone in their system.
Okay, let's take Azuka from Rivers. Azuka, good morning.
Azuka, good morning.
Good morning. Good morning.
Yeah, good morning.
My question is, can too much intercourse cause
erectile dysfunction?
Yes.
Too much intercourse.
Thank you very much, Mr. Azuka.
It's a lovely question.
Yes, yes. Thank you very much. It's a practical question. No, it cannot cause erectile dysfunction, sir. It cannot cause erectile dysfunction. So back to your question. I was going to say that in some situations,
you say some people will be born with one testicle.
Yes, some males can be born with just one testicle. Some can be born with even 3. We've seen that happen. Yes.
3?
Yes. But in a situation where, in some children, okay, we usually discover that they may have one testicle or one testis, and you may think they have just one testicle. We have it in a condition called undescended testes. Okay, so usually one of the testes will not descend. It will still be retained in the abdomen. Usually in the course of development, the testicles will be inside the abdomen. But shortly before the completion of growth and before a child is born, 2 of them would have descended to that sac. Now, essentially why it is so is that the temperature in that region has to be at a reduced temperature from that of the body. Okay, so to encourage the spermiogenesis and some other conditions. But oftentimes we see children that are born and they will have just one single testis. So they may have one is retained. So if you have a child, if you have a little child in your house that is still within a year or 2, I have seen situations recently this year, last year to this year, I've seen a case of a man whose 2 children, one was aged 18, while the other one was aged 8. Both children had one single testis, and the man never noticed. Okay.
And when the moment they bath the pikin, they shake. All this thing, African way. Our mama when we small, if they bath us, one by one for you go to say then they play. No be play.
Also, when you have such situation, what you can do is that usually you need to do the correction on time, so that the 2 testicles will start growing together, so that it won't affect the child's fertility in the future. Usually, such surgery should be done before the age of, I think, 2 or 3 or thereabout. This year alone in our center, we have had 2 such surgeries for undescended testes.
But this ones where they don't call enter 18, consider the CV do
the fertility will be affected somehow. But you cannot say that such a person may not be able to, but the fertility, of course, will be compromised. We have Femi from Kwara State. Femi, good morning.
Good morning, Femi.
Yeah, hello, good morning.
Good morning, sir.
Please, I heard this your topic this morning.
Okay.
And it so much interests me.
God bless you. Go ahead with your question.
I want to ask the doctor one question.
Go ahead.
Doctor, sir, you said that drugs that normally causes erection dysfunction.
Yes, sir.
Like me now, I'm hypertensive, and then doctor prescribed 1 drug for me, and I've been using the drug. So I want to ask a question. Maybe you can say a particular drug that might be used so that it won't affect this erectile dysfunction.
Thank you very much. Thank you very much. But unfortunately,
we still need to talk to you
privately. Unfortunately, I may not be able to answer such a question.
Dr. Batten, contact, you go come now. This one and one-on-one, I go do. I go do 2 aside.
We can have a tete-a-tete. I may not be able to, because in trying to do so, I will mention medical names that you may not know. So somehow I'll be tempted to mention the brand names that everybody will know. But
and if you do that,
we
we'll
can't.
Be happy.
Yes,
it's advert for us.
Yes, we can't exhaust the list. But your doctor too, you can go back to your doctor, tell your doctor that you saw this program on TV where doctor was talking that some hypertensive drugs can actually cause erectile dysfunction.
Or better still, just call doctor after
see
the
his
show.
number, copy it one-on-one.
So they can do a review of your medications for you. Not just hypertensive drugs. We also talked about painkillers that belong to the family of non-steroidal anti-inflammatory drugs. And I can tell you that 80 to 85% of all the painkillers we take in this environment belong to this class of drugs. So if you're on such drugs persistently for a long period of time, you might start having such challenges as well. No, you don't need to. Also, the drugs that are even used for the treatment of depression, antidepressants, and anxiety disorder too have also been implicated. Okay, we refer to them as SSRI, SSRI, selective serotonin reuptake inhibitors. Okay, so you can see now nobody will know the name. But once I mention the brand name, I sabi the drug.
But really, whenever they take drugs for depression, I think it's also
everybody
so very quickly, diagnosis. Yes, we should. Diagnosis. How do we diagnose this condition? How do we know if we have it? Permit me to say that most of the time, the diagnosis can be made from the history. Once somebody tells you that I've been married for 1 year, for more than 6 months, I've not been able to achieve erection. Of course, you know the person also has a challenge. Now, the diagnosis will range from doing investigations on the line of some of these causes that we have mentioned. Number 1, you need to do investigations along the line of hypertension. You want to do a chest X-ray for this individual. You want to do an ECG. You want to do a lipid profile, fasting lipid profile. You want to look whether this person has elevated cholesterol, whether this person has challenges with dyslipidemia. Okay. You want to also do some tests to make a diagnosis of diabetes. Top on the list is urinalysis, as simple as it is, and sounds, and cheap as well. You want to do a fasting blood sugar. You want to do a random blood sugar to rule out diabetes. Okay, so you also want to do a hormonal profile. It doesn't have to be just a female. The female can do a hormonal profile. Males too that are undergoing treatments for this condition also do hormonal profile. Okay, so also you may want to send, if the man may have to go for scrotal ultrasound. So the investigation basically will be tailored along the line of the possible causes. Okay. Don't forget we said at the beginning that a number of causes, and we mentioned different subheadings where you could have this. So we cannot exhaust all the tests that one will need to do. But ahead of doing all those tests, the doctor should have a detailed history. We will refer to that as clerking of such a patient, the presenting symptoms, and as well as general and systemic physical examination. By the time a doctor does all of this and sends for investigation, he will be able to know whether the erectile dysfunction is being caused by a cardiovascular problem, endocrine problem, or hormonal imbalance, or otherwise. Okay, I'm getting signals that our time is up, but hopefully we'll continue
next week.
Doctor, quickly, I want to make
next week we are going to talk about we are going to complete diagnosis, and then we go to treatment, because a lot of people want to hear. You've been said so much about this. How can it be treated? What can we do?
Doctor, I want you to quickly pen down this question in case I forget next week. Say people they mistake erectile dysfunction with fertilization. People think say one person no feel fertilize. Maybe
we will still get to that. That will come under infertility.
So on top of that, ladies and gentlemen, we say we learn something, and we want to say thank you very much. For those who want to call doctor, now the number is there. Please feel free to call doctor. And from me, I say thank you very much.
For me, I will see you guys 1 to 2.
So see you next week.
Goodbye.
Thank you very much.
Thank you guys for
coming back.